ठिक छ सबैले सुनिरहेछ है
Yes, sir.
Yes, sir.
के छ बोरिङ रिसेन्ट एडभान्स रेडियोलोजीको बोरिङ छ कि अब के यु आर इन्जोइङ दिस टपिक
एकदम इन्जोय गरिरहन्छ सर पछि गएर नि भन्नुपर्छ
हो कि फेरि एकदम बोरिङ भयो यो एकदम नचाहिने सब्जेक्ट अब हामीलाई चाहिँ खालि एक्जाम पास गर्नलाई मात्र चाहिने यो हाइफाई कुराहरू भयो कि भन्ने होला तर बट यु सुड नो है अब अहिले पहिला जस्तो छैन रेडियोलोजी भनेको सब्जेक्ट सबैभन्दा चाम भएको सबैतिर टपमा आउनेले पढ्ने रेडियोलोजी त्यसमा पनि इन्टरभेन्सन भनेको अहिलेको रेडियोलोजिस्टहरुकोमा पनि सबैभन्दा एकदम चाम भएको एन्ड यु क्यान डु भेरी भेरी बिग प्रोसिजर विथ very minimal. These are quite minimally invasive procedures, so you can save a lot of patients. You know, like you can do major like surgeries on a daycare basis, right? It is quite life-saving procedures, and these are minimally invasive. Just now you can see there is a case of splenic trauma. Because of splenic trauma, there is injury to the splenic vessels. You can see there is collection along the perisplenic region. You can see here there is like prominent vessels, contrast extravastions are there. So angiogram again on the splenic artery, selective angiogram was done, which showed there was injury with leakage of the contrast. So coiling was done. You can put the coil and just release it. So what happened? These vessels were completely occluded. So splenic injury was completely healed. So otherwise you would have to do splenectomy, which is a big surgery, but here within 15 minutes you can do splenic artery embolization and the patient like is completely healed, and the patient within few days can go home. So you can do the same thing again here. Again here, this is a case of renal angiogram. You put the catheter over here. We did the angiogram on the middle part of the like segmental renal artery. There is an aneurysm, and this sort of aneurysms are most commonly seen where you do kidney biopsies, where you do PCNL, like some invasive renal procedures. Even we have also encountered this type of problems, like few of these type of problems, like while undergoing PCNL, while undergoing like renal angiogram biopsy, like kidney biopsy for like some renal like nephropathy, some pathologies. So unfortunately there was injury to the vessels which developed into the pseudoaneurysms. What we can do, again, we can do the renal angiogram and we can block this vessel. We can block this angiogram, the kidney will function. There is no injury. You don't have to open the kidney. पहिला के हुन्थ्यो conventional. You have to open the kidney. You have to see whether the vessel is bleeding or not. You have to tie the vessels. It was a big surgery and it used to do a big amount of damage to the kidney. There is nothing, no damage, nothing. You can just like do the angiogram. You can do the coiling. the bleeding or the hematuria is almost cleared. Same thing again, the trauma, case of road traffic accident. Here you can see there is aneurysm of the hepatic artery. You can see again there is aneurysm, like pseudo aneurysm. This is not the aneurysm. Aneurysm are congenital. These are pseudo aneurysm due to the trauma. You can see there is trauma along the right lobe of the liver, and this segmental branch there is aneurysm. We did angiogram which showed aneurysm, and again we put the coil. What happened? That bleeding is completely over. So almost it is like, the patient is cured. Otherwise, to do surgery is not easy. And like if it is within the liver parenchyma, you don't know where is the exact location, from where is the source of bleeding. So you can just put a coil. It's quite easy. Like hepatic artery embolization is not that difficult. Even similarly, you can do TACE. TACE means, a transarterial chemoembolization. If there is hepatocellular carcinoma, you can put the chemotherapy, like chemoembolization through the hepatic artery on the tumor. If there is a tumor, you can put the chemoembolization, which can cause occlusion of that tumor, and the tumor will shrink and become non-functioning. So without doing surgery also, you can treat the tumor. Like even metastasis also nowadays, it is quite common among the like oncosurgeries. Now, again, the case of hemoptysis, the patient present with very severe hemoptysis with old history of tuberculosis. So there was a cavity, and from the cavity, like there was injury to the bronchial artery. There was bronchopulmonary arteriovenous fistula, bronchopulmonary fistula. So because of that, the patient developed severe hemoptysis. What was done? Again, there was a angiogram was done, and through previously we did like embolization through the coil, but now we can use like embolizing agents are there, like polyvinyl alcohol, gel form, etc., which can go, and these are like some particles are there, small particles. For uterine artery also, for big fibroid also, you can do the like occlusion, and you can like shrink the fibroids. Even for brain tumors also, you can do, before doing the surgery, if the tumor are big, you can put this like embolizing agents, which will occlude the blood supply of the tumor, so the tumor will shrink and the surgery will become quite easier. Right? यहाँ पनि हेर, bronchial artery, there was some vascular malformation due to the cavity, erosion by the cavity on the vessel. So what we did, this chemoembolizing agents were introduced, and it caused like complete occlusion. Now there is no bleeding at all. Previously there was some bleeding over there in this arrow. Now it is completely occluded. About brain ma, like there are like MRI brain ma, yeah, we discussed about MR diffusion weighted MRI. अब अहिले नयाँ MRI मा चाहिँ there is like new software. It is called MR spectroscopy. You can do this spectroscopy for brain, and you can do it for prostate also. So यसले के गर्छ त, स्पेक्ट्रोस्कोपीले ब्रेन भित्र कुनै एउटा लिजन छ, whether it is a tumor, whether it is a granulomatous lesion, whether these are congenital like lesions are there, त्यो भित्र के छ त, what are the components, normally के components छ त भनेर छुट्याउँछ. जस्तै ब्रेनमा कुनै पनि चिजमा, ब्रेनमा ट्युमर छ भने के हुन्छ, there will be increase in the metabolism. There is quite increase in the metabolism. त्यसले गर्दा के हुन्छ त, there is a overproduction of this choline. Yeah, different like parameters are there, 3.6, 2.6, 1.6, etc. यहाँ हेऱ्यो कोलिन. कोलिन भनेको चाहिँ के हो त, जहाँ पनि ट्युमर हुन्छ, एब्नर्मल ग्रोथ बढी जहाँ हुन्छ, the peak of the choline is increased. So यदि ब्रेनमा ट्युमर छ, हाई ग्रेड ट्युमर छ भने कोलिन will increase. तर नर्मल ब्रेनमा चाहिँ NAA, N-acetyl aspartase भन्ने हुन्छ एउटा केमिकल, which is seen in the brain, like white matters. Normal wave ma ke huncha, Na should be quite high, choline should be quite low. है normal brain ma. तर केही गरी कुनै ट्युमर छ जस्तो लिजन, कुनै एउटा लिजन छ ब्रेनमा, you have to characterize whether this is a tumor, whether this is a benign lesion, whether it is an abscess छ भने के हुँदो रहेछ त भनेर we will just discuss. Together with MRI, यहाँ हेर, there is a tumor on the left, like temporal lobe with edema on the brain. यहाँ के छ त, अहिले हामीले हेर्यौँ नि, यो अगाडिपट्टिको, this is NAA, अगाडिपट्टिको कोलिन. But here instead, NAA is reduced, choline is quite high. So NAA high भएर कोलिन कम हुनुपर्ने ठाउँमा कोलिन चाहिँ एकदमै हाई, NAA is quite low भनेपछि it is malignant, it is a tumor, right? So this is tumor. So even we can further characterize, like what type of tumor is there, what are the chemical components within that lesion in the brain, right? You can come even more closer to the diagnosis. So even operate गर्ने हो भने कसरी गर्ने त, then neurosurgeons can plan. If it is a low grade tumor, they can wait. If it is a very high grade tumor like glioblastoma multiforme, anaplastic astrocytoma, then they have to become even more aggressive. And कहाँसम्म operate गर्ने, कति part operate गर्ने भनेर they have to see. Now here again there was a lesion. We are confused whether there is a tumor, like whether it is something else, whether it is a necrotic tumor like glioblastoma multiforme भनेर सोचेको. We did MR spectroscopy. के भयो त? There was lactate peak was reversed. Lactate केमा भेटिन्छ? Lipid lactate भने it is seen, lactate is seen in necrosis or abscess. So this was a case of abscess. Luckily it was a case of abscess which can be treated. It is not that like dangerous like brain tumor. So this MR spectroscopy helped us to differentiate between whether it was a tumor, whether it is a high grade tumor, whether it is a metastatic tumor, or it is a benign inflammatory or infective conditions like abscess. One of the last, like recent advancement which you should know. कसैलाई पनि रिलेटिभहरु कसैलाई लाइक यदि कुनै प्रब्लम भयो, म्यालिग्नेन्सी देखियो भने, म्यालिग्नेन्सी भएर जस्तै लङ म्यालिग्नेन्सी अर कोलोन म्यालिग्नेन्सी, त्यो कोलोन मात्रैको सर्जरी गरेर त हुँदैन. There could be metastasis. Metastasis even only by doing CT scan might not be picked up. There are micro metastasis. Only the chemical like components are there, त्यो अरु पार्ट्समा त्यो केमिकल चेन्जेसहरु भएको छ कि छैन भनेर how you can detect? Through radioisotope imaging known as FDG PET scan, positron emission tomography. नेपालमा पनि छ अहिले, like के हुन्छ त? You can see there are red spots are there. You can see there was a mass in the lung. There are lymph nodes which are also very high. Again, you can see there is a supraclavicular node which is also causing increased uptake of the radioisotope component. So there is a mass on the lung, lymph nodes are there on the opposite side, supraclavicular lymph nodes are also there. So this is there is already distant metastasis. So if you would have done CT scan, small supraclavicular lymph node might have been missed. Even opposite side, small lymph nodes are there. You might be confused whether it is benign or malignant lymph node. There is a tumor on the lung. There is supraclavicular lymph nodes where there is also again increase in the like uptake of the radioisotope. Again you can see there are the mediastinal nodes on the opposite side. So it became quite like late stage of the tumor. Again you see CT scan was done, and like it was a case of lung mass, nothing on the lung, but we did FDG PET. What we saw was there was some increased uptake in the vertebra. So this is a case of vertebral mets. Lung tumor has been like almost lung tumor is there. So what else is there? There is metastasis on the like upper dorsal, like vertebral body. Similarly, you can see there is lung mass. There is a lung mass. There is increased uptake in the lung mass. Again, here you see on the bone, on the sternum, again, there is increased uptake. And here on the, like supraclavicular or on the adrenal, right adrenal region, there is again increase in the uptake. There is some hotspot is there. So this was a case of CA lung with adrenal mets, and these sort of patients present with paraneoplastic syndromes. The CA lungs might be detected later on, but actually the patient initially might have presented with some other features of, like hyper adrenalism. So this is a case of CA lung with adrenal mets, which can be quite like nicely depicted on FDG PET scan, PET CT scan. This is a PET scan with CT scan. This is the fused images. Now, finally, like in Nepal, there is only one center with FDG PET. It is quite expensive. All the cases, for all these, like cases, you can't do, like FDG PET also. It is quite expensive. So what are the other options? There is, like on our MRI, what we have got one option called whole body diffusion. Diffusion लाई हामीले एकदम इन्फाक्ट भनेर भेरी अक्युट इन्फाक्ट भनेर डायग्नोसिस गर्यौँ. त्यस्तै होल बडी डिफ्युजनले चाहिँ कहिलेकाहीँ भेरी हाइपर एक्युट मेटास्टेसिस अन द लिम्फ नोड पनि डिटेक्ट गर्दो रहेछ. सो इट इज अल्दो लाइक गोइङ अन लाइक दिस यो रिसर्चहरू लाइक इट इज गोइङ अन वेदर लाइक होल बडी डिफ्युजन can replace FTG PET or not. Like a lot of like studies are going on. You can see here there is a large lobulated like mass on the neck and extending into the mediastinum. The whole body diffusion was done. Here you can see there is a mass on the mediastinum which is going towards the cervical region, and together with that you can see multiple metastasis on the bone. These are the these dark spots on the vertebra, like you can see these are the metastasis. So this is all for today. के छ, के कन्फ्युजन केही छ आजकोमा? सुनिरहेछ?
होइन सर, सुनिरहेछ.
सुनिरहेछ है. So today we discussed about like newer imaging modalities. के देखिन्छ त, जस्तै अब congenital anomaly स्क्यानहरु गर्नु पर्यो हैन, एन्टिनेटल छ भने 3D 4D अल्ट्रासाउन्ड where you can detect like cleft lip, cleft palate, club foot, meningomyelocele, quite clear. These things will become quite clear, almost like a like a 3D, like a fetus, live born fetus. त्योबाट चाहिँ early like you can detect the congenital anomaly and you can plan accordingly. त्यस्तै हामीले के डिस्कस गर्यौं, एन्जियोग्राम, कोरोनरी एन्जियोग्राम, पहिला कन्भेन्सनल कोरोनरी एन्जियोग्राम which used to be like quite painful, like there like at least the patient has to stay in the hospital for few days. तर अहिले चाहिँ यदि माइल्ड सिम्पटम्सहरु छ भने what we can do CT angiogram and almost get same quality of images हैन. त्यो एउटा भयो. इभन फर द पेरिफेरल भेसल्स, किडनी ट्रान्सप्लान्ट गर्नु छ भने रेनल भेसल्सको बारेमा यु क्यान नो इच एन्ड एभ्री डिटेल्स. त्यसपछि इन्जरी छ भने यु क्यान डु सिटी एन्जियोग्राम अफ द लाइक लिभर, स्पिन अफ द अर्गन अफ द बडी. यु क्यान फाइन्ड आउट द लिजन्स. अनि अहिले इन्टरभेन्सन रेडियोलोजीले के गर्न सक्छ त, विदाउट डुइङ सर्जरी, जस्ट लाइक अ कोरोनरी एन्जियोग्राम लाइक प्रोसिजर, इफ देयर इज एन्युरिजम, एबी मालफर्मेसन एसेट्रा, or even cancer also, you can do embolizations through percutaneous, like transarterial route. Even big tumors in the brain and various part of the body, what you can do, you can put the embolizing agents, you can shrink the size of the tumor, maybe some big fibroids are there. If you block the uterine artery, what happens? It won't get proper, like nutrients or the blood supply. So what happens? It will undergo degeneration. And खाना नपाएपछि दुब्लाएर सानो हुन्छ. The surgery will become then quite easier. And यत्रो ठुलो 10 centimeter को tumor shrink भएर 3 centimeter मा आयो भने you can do laparoscopic technique. एउटा त्यो भयो. Again we discussed about MRCP. कहिलेकाहीँ severe pain abdomen छ, the patient is having recurrent abdomen छ भने we can look for some congenital cause of like pancreatitis, like pancreatic divisum, annular pancreas, etc. And in obstructive jaundice, what we can see, we can look for the stones in the CBD, like through MRCP, without doing any invasive technique. We can do MRCP, we can look for any injury on the common bile duct, and we can plan accordingly. त्यस्तै हैन, अब जस्तै renal artery को कुनै renal trauma भयो, splenic trauma भयो, if there is hemoptysis, if there is like GI tract bleeding, we can do angiogram, and then we can do the like occlusion of the vessels, whether through the coil or the embolizing agents, through arterial route. Similarly, virtual bronchoscopy, virtual colonoscopy are the various techniques. These are non-invasive techniques where you can do and you can find out some lesions, whether it is malignancy, polyps within the colons, like without undergoing colonoscopy. When in some patients who are like not that comfortable doing this colonoscopy and some invasive procedures, at least we can do virtual colonoscopy. है त अनि एमआर स्पेक्ट्रोस्कोपी भन्ने एउटा नयाँ आउँछ, जस्तै डिफ्युजनमा भयो, हाइपर एक्युट इन्फार्क्टहरूलाई हामीले डिफ्युजनबाट हेर्न सक्छौँ। त्यस्तै एमआर स्पेक्ट्रोस्कोपीबाट केमिकल कम्पोजिसन के छ त ब्रेनभित्रको लिजनमा, ट्युमर होस्, वेदर एब्सेस होस् या कुनै अरू नै चिजहरू होस्, you can find out the chemical components and you can grade it, whether it is a high grade tumor, whether it is an abscess, whether it is a tuberculosis, etc. एउटा त्यो भयो एमआर स्पेक्ट्रोस्कोपी। अनि त्यसपछि एफडिजी PET scan is nowadays quite common among the oncologists, especially to look for like any tumors, whether there is metastasis, quite early metastasis, so that if you do surgery and if there is already metastasis, there is no use, like no benefit of doing surgery. Instead, you could have undergone, like this one, neoadjuvant chemotherapy. So, like the planning nowadays to become a good surgeon, it is not like, like you should be quite selective. You should know when not to operate. Patient operation you should know when not to operate. So nowadays, a successful surgeon should know when not to operate, and you will know when not to operate if like he finds a good radiologist, good imaging, which guides him whether this surgery, this tumor, this case is operable or not. And in case, if it is like if you open and if it is inoperable, all the blame comes to the surgeon. So if the radiologist can guide him, oh no, don't do this surgery, there is already metastasis, there will be only blame, like your all reputation will go. So even PET scan, whole body diffusions are these various imaging modalities which can help the like surgeons or like any treating clinicians. And even you can see whether the like response of the chemotherapy is correct or not, whether it is good enough or not. You can do the analysis by doing PET scan also. है त यति नै गरौँ आजलाई। के छ, कुनै कन्फ्युजन केही छ तिमीहरूलाई? सबैजनाको सुनिएन है, फिजिकल प्रेजेन्स भएको भए इट वुड हेभ बिन क्वाइट इन्ट्रेस्टिङ। सबैजनाको एक एकको ओपिनियन पनि लिन मिल्थ्यो। अब यो जुमबाट भए पनि अलिअलि क्लासहरू भइरहेछ हैन। अब यो रेगुलर क्लासहरू सुरु भएपछि इफ यु हेभ गट एनी सर्ट अफ कन्फ्युजन्स हैन, यो उसमा आएर डिपार्टमेन्टमा आएर कतिजनाको तिमीहरूको त पोस्टिङ पनि भयो होला, यहाँ कतिको हुन बाँकी छ हैन, जसको बाँकी छ त्यो बेलामा पनि आऊ हैन। इफ यु हेभ एनी सर्ट अफ कन्फ्युजन यु क्यान जस्ट डिस्कस विथ अस, ओके? है त, ल आजलाई उसो भए अब यति नै गरौँ है त।
हस् सर, थ्याङ्क यू।
हुन्छ।